Tonight we have Dr. Christine Newsom. Christine practiced as an internist in Nevada County for almost 4 decades. She took care of patients with cases of pulmonary and cardiac diseases, and tonight she's going to talk about some potential public health effects of reopening the Idaho-Maryland mine.
Okay. Thanks, Greg. Appreciate that nice intro. Good evening, everyone. I've been asked to talk to you about the potential public health effects of reopening of the Idaho-Maryland mine by the Rise Gold Company, which you probably know is headquartered in British Columbia, Canada. And while there are many potential effects and potential risks of reopening the mine, I plan to divide my comments into 4 general sections: air quality effects, water effects, noise effects, and psychosocial effects. Before we even get into those areas, though, I would like to review with you a map that encompasses the area of the mine's activities and how it relates to Grass Valley and Nevada County. Could I have that first map slide, Stephanie? Okay, I'm not sure my cursor, can you all see my cursor on that or not? No, okay, so you're just going to have to, okay. Stephanie, is that your cursor? Okay, so hopefully you can just follow my commands. Okay, you'll see here for broad outline Highway 49 in the left part of the map. No, that's 174. 49 is a northeasterly, southwesterly transection. There we go, that's 49. In the pink violet, you'll see the city of Grass Valley. And you'll notice not only is it in its most obvious color against a white background, but it extends rightward on the map or eastward on the map against part of the gray background. And I'm going to explain that gray, but I just want you to understand that it overlaps both the white and the gray. In green, you'll see the Empire Mine State Park. There we go. Okay. Now, take a look at the gray, and superimposed on the dark gray, you'll see 2 patches of light gray. And incidentally, any one of you who has spent a long time dealing with the potential mine, you know all this, but I'm reviewing this for those of you who are just coming into the subject of the Idaho-Maryland mine, and I myself had to review a lot of this when I started out. Okay, the light gray areas are the 2 above ground areas that are now owned by the Rise Gold Company. And they are up at the top here. You see, leave your cursor there, okay, on the Centennial Industrial Site. There's the one. And incidentally, this Centennial site has nothing to do with the Centennial Dam. And again, I'm mentioning that only for your clarification, because when I was new to this subject, I was confused about that. Centennial Mine has nothing to do with the Centennial Dam. Okay, let's go down to the other light gray site, and you'll see that's the Brunswick Industrial Site. Now, in the dark gray, and Stephanie, can you just sort of outline the exterior margins of the dark gray? That is the outline of the mineral site that is owned by the Rise Gold Company. That means they own the rights to 200 feet below ground on down below that. They have the right to dig, burrow, explode, or do anything they want to all of that territory, starting at 200 feet going on down. As you can see, part of the city of Grass Valley overlies the northern part of those mineral rights. The intention of the company is to enter at the Brunswick Industrial Site, that lower light gray area, enter their underground operations and do their exploration, their burrowing, their all of whatever they're going to do underground, enter from that site, bring up all their underground ore, and process it above ground there at the industrial site with all of their stamping, crushing, processing, then load up that processed ore into 20-ton diesel trucks and drive it down Brunswick Road north, and then turning left or west onto Whispering Pines. Good, where that you follow that arrow, and then dumping it off at the Centennial Industrial Site. This will entail up to 100 round trips of these 20 to 40 ton diesel trucks per day, 16 hours a day, 7 days a week. So that's the orientation that we're talking about. Well, let's get started on the direct effects of the mine. Can we have the next slide? You all have heard an excellent talk, those who have been tuning into these seminars, you've had an excellent talk by Pam Hurd, who is a respiratory therapist, in March, I believe. And I want to thank Pam for the detailed information that she analyzed and delivered. And I am repeating a lot of her material. She made a good point that in analyzing any health risk, it's essential to know what the baseline risk is. And for those of you who are not aware, Nevada County's baseline air quality gets an F grade from the American Lung Association in its State of the Air annual report. And let's look at some of the numbers specifically. What you see on this slide is data taken from a 2019 community health needs assessment that was commissioned by Sierra Nevada Memorial Hospital and the County of Nevada. And I've extracted here just some of the respiratory disease data. As you can see, Nevada County has almost double the annual mortality rate from chronic lung disease at 69 cases per 100,000 people, compared to 35 per 100,000 for the state of California. The asthma prevalence for our whole county is about 12%. And for the state of California, it's 8.7. Mortality rate for heart disease is 224 per 100,000 people annually versus 157 for the state of California. These numbers are a result of many complex factors, like some are behavioral, like cigarette smoking, but many of them are environmental, like ozone and other greenhouse gases, particulate matter like smoke from our wildfires, and some occupational pollutants. And you might say, well, how can this be since we have so little heavy industry in our beautiful foothills? Well, we do know that weather and wind patterns often funnel pollutants into our county, and especially the Brunswick Basin, from the Central Valley, to the extent that sometimes we've been described as, or our area has been described as the tailpipe of the Central Valley. Into this already toxic air is being proposed an industrial operation, the Rise Gold Mine, which will be introducing a host of additional air pollutants. First of all, there will be all of the machinery at both that Centennial site and the Brunswick site, and all those trucks traveling in between the two sites every day, virtually all of which will run on diesel fuel. Now, as this slide shows here, diesel exhaust contains many greenhouse gases, some of which are toxic in their own right, and some of which form ozone. All of these can cause asthma, wheezing, coughing, and shortness of breath. I want to mention in regard to ozone, again, for some of those of you who might be new to this whole area, ozone can be confusing because we do want more ozone high in our atmosphere because it protects us from ultraviolet light. We don't want it anywhere near our bodies because it is very irritative to the lining of our airways, where again, it can cause terrible wheezing, shortness of breath, and chronic lung disease. Diesel fuel also contains particulate matter, which is abbreviated PM, which causes the same list of problems. And particulate matter can be, well, it's usually thought of as anything less than 100 microns, but in diesel, the really nasty stuff is from 5 to 1 microns. And the parts in diesel that we're concerned especially about causing cancer are less than 1 micron. The California Air Resources Board estimates that about 70% of cancer risk from breathing toxic air contamination, 70%, comes from diesel exhaust particles. Additionally, there's a piece of information that is literally hot off the press. It just came out this week in the journal, American Journal of Respiratory and Critical Care Medicine. And that is that women who were highly exposed to ultrafine particles in air pollution during their pregnancy were more likely to have children who developed asthma. And this is the first time that asthma has been linked with prenatal exposure to this type of air pollution. So that's pretty sobering. In addition to the pollution from diesel vehicles that we're worried about from the mine, we're concerned about fugitive dust, or dust from the mining process, which includes the crushing and processing of the ore and transporting and spreading of the ore at the Centennial site. This blasting and crushing and spreading results in emissions of dust filled with trace levels of heavy metals, and that's according to the mine's own air quality report. But in addition, there are 2 particles of particular concern to me. The first is silica fibers, which can result in silicosis. That's a type of pulmonary fibrosis caused by breathing in tiny bits of silica. And this occurs over a period of years. But again, exposure to silica can cause wheezing, asthma type symptoms, coughing, shortness of breath, and ultimately irreversible scarring of the lungs. And of great concern is the risk of asbestosis as a result of asbestos fibers, which are found in certain types of asbestos ore, such as serpentine and serpentinite. Asbestosis is a chronic or long-term lung disease, which really is a collection of different types of lung diseases. But they involve scarring of the lungs, lung cancer, a special kind of lung cancer called mesothelioma. Actually, it's cancer of the lining of the lungs and the lining of other organs in the body. The Rise Gold Company took ore samples over the last few years and has had them analyzed. These samples indicate that there will be both silica and asbestos fibers being released by the mining, drilling, ore crushing, and refining activities. Although it's assumed that the mining company would be using adequate protective gear to protect their employees from exposure to this dust, there does not yet exist any specific asbestos risk management plan that can reassure us that the public will not be exposed. Next slide, please. The mine has written that it will put certain mitigations in place, including Tier 4 diesel engines. Those are engines that regulate the amount of particulate matter, and nitrogen oxides that can be emitted. Filters on the mine ventilation fans, keeping the mine dust wetted down, rinsing truck tires before leaving work sites, and tarps, putting tarps to cover the extracted materials. But it's up to the Air Quality Resource Board to do the monitoring for compliance, and they are severely understaffed. So the public would be at the mercy of the mine operators for the most part. If the mitigation measures are insufficient to control an unacceptable problem, there's no clear plan of action. Sadly, most of the health consequences of exposure to both diesel exhaust and fugitive dust can take a long time to develop, so it could be years before the alarm might be sounded. My conclusion is that there is a substantial risk of increasing air pollution with ozone, other greenhouse gases, particulate matter, fugitive dust, and possibly cancer-causing asbestos from the mine, that we cannot accept this liability in our community.
Christine, can I interject something? I've noticed a couple people have raised their hands. I just want to tell those people that if they want to say something or make a comment, to please put it into the Q&A, and we will kind of direct it to you as appropriate. So instead of raising your hand, folks, at this point, please put your question or comment into the Q&A. Go ahead, Christine, just wanted to let.
Sorry, I'm unable to see any raised hands.
That's fine, yeah.
Let's look at the effects on water. The mine owners have stated that they plan to pump out 3.6 million gallons per day of water from the mine for the first 6 months, and then 1.2 million gallons per day for the next 80 years of operation. That's a staggering amount of water, and the effect could be far-reaching. There are at least 300 private residential wells that lie above the mineral rights of the mine or nearby. And as the water tables get drained, some of these wells may well go dry. They probably will go dry. That's not just a theoretical risk. When the Siscon mine was in operation on the San Juan Ridge in the 1990s, 12 households lost their wells before the mine was shut down. Furthermore, the hydrology of this dewatering process is such that contaminants remaining in the aquifer may be co-mixed with residential water, resulting in property owners finding their water poisoned. Another consideration regarding water quality. The mine owner's claim is that the water's quite clean. Actually, the mine water currently has iron levels that are over 5 times the maximum contaminant level, or MCL, manganese levels over 4 times the MCL, and arsenic levels over 3 times the MCL. This water needs to be treated before being pumped into Wolf Creek, which runs through Grass Valley, and from there into the Bear River, then the Feather River, then the Sacramento, and then the San Francisco Bay. The Rise Company claims that after it is treated, it will be equal in purity to drinking water. But what does that mean? According to the mine application documents on file with Nevada County, mine water discharge would be treated to remove manganese, iron, and arsenic, bringing the quality up to what is referred to as secondary drinking water standards. Treatment to secondary standards generally only removes certain water quality contaminants identified on a list of about 15 items. This meets standards for discharging into a creek, but it is not drinking water quality. To bring the water up to primary drinking water standards, bacteria and dozens of additional contaminants need to be removed. This level of treatment of the effluent would not be achieved, and the effluent would not be something that any of us would want in the drinking water of our family, or our communities. And even if the water were acceptably clean, it's hard to predict what the effect on the local habitat, flora and fauna, and agriculture would be with the addition of such huge volumes of water to the watershed. So for qualitative and quantitative considerations, the reopening of the mine will have huge consequences. Let's turn now to the effect of the mine on noise levels. Could I have the next slide, please? Okay, this slide gives you an idea of the levels of noise that we are commonly exposed to in our daily lives, measured in decibels. You can see that normal conversation usually comes in at about 60 decibels. That's in the sort of light green area. And other common household noises are usually somewhere between the 50 to 70 range. When things come in around 80 decibels, we perceive them as noisy. Look at school children in a noisy cafeteria there. OSHA actually recommends that we not be exposed to levels above 85 decibels for a continued period of time without ear protection. And you can see why by the next graph. Could we look at that? Okay. And I'll let you take a while to digest all this data. Measurable damage to the ear's hearing apparatus starts happening with continuous exposure to noise above the levels listed here. Okay, so we really have to be careful once we start getting above 80, the high 80s in decibels for any continuous period of time. Now let's look at the next slide to see what noise will be generated at the industrial sites of the proposed mines, proposed mine between both the Centennial site and the Brunswick site. This is data taken from the University of Michigan. And as you can see, we're talking about compactors, excavators, front-end loaders, graders, loaders, pile drivers, roller compactors, earth scrapers. All of those would be used at both sites, really. And then, of course, the trucks, and that's just the 20-ton truck. Now, these are levels of noise, of course, that would be experienced right by someone standing right at the site. The public isn't going to be right at the site. So these levels of noise degrade with distance. But remember that it will be necessary for many neighbors to drive by these sites frequently, maybe hundreds of times over a period of years on the way to school or work. And it's difficult to know or measure to what extent the noise will degrade with distance. Will a 100 decibel noise degraded by distance to 85 decibels do the same damage over 8 hours that it would in 15 minutes if you were standing next to it? That's a hard thing to know, or it's impossible to measure really right now. And don't forget, the damaging effect of noise on the ear isn't limited to just hearing loss. These damaging effects also include tinnitus or ringing of the ear, vertigo, and depression. Because the onset of these symptoms can sometimes be very subtle, there may be a long delay between noise exposure from the mine and realization of the causal relationship to these symptoms. And while we're considering noise hazards, we must also address subterranean noise and vibration from underground explosives, which will be used extensively in the mine or under the mine. Rise Gold has submitted data indicating that the explosives would be occurring deep enough that the vibrations would not be felt or heard above ground. But these are theoretical studies with no guaranteed outcome. Again, we're being asked to trust Rise Gold's word. I'd like to return to that map for a moment and bring your attention over here on the western edge. Stephanie, maybe you could outline where you see that Scotty Dog silhouette. I can't point, but can you use your imagination way over on the west or left-hand side, over on the left? Can you see the little Scotty Dog? Look on the gray, dark gray. You're near it. Look to the left of the Centennial. There you go. You see the gray? There, you're at it. See the Scotty Dog? Okay, look at the ear of the Scotty Dog. There, right there where the ear is. That's Sierra Nevada Memorial Hospital. Okay. As well, bear that in mind. Additionally, I thought I was going to have the cursor for this part, but since I don't, I hope you all can follow along with me here. Try to imagine the sort of rhomboid outlined by Idaho-Maryland Road, which is down here. Let's see, how can I say this? Yeah, underneath the Scotty Dog's neck. Good, and go about halfway down Idaho-Maryland Road. Halfway down, stop, no, come back. Then you hit Sutton Road. Go due north on Sutton Road, halfway towards Brunswick with your cursor. Go, stop, and come back to Highway 49. There you go, and back down again. Okay, that quadrant, let's call it a quadrant, over to 49. Within that quadrant, you have 4 skilled nursing facilities. You've got Atria, excuse me, you've got Crystal Ridge, Atria, Spring Hill Manor, and Golden Empire. So imagine if Rise Gold found a particularly valuable vein of ore that they decided to start blasting in that quadrant. And that lasted for months or years. And couple that with all the noise produced at the Centennial site, which is that upper left, that light gray area. Can you imagine the noise and vibration generated and conducted to the patients in that acute care facility and the long-term chronic care facilities in that proximity? What if you had a loved one in one of those facilities, or if you yourself were in one of those facilities? I just ask you to contemplate how that would make you feel. And that's a good segue into the final area I wanted to discuss, which is the psychosocial effects. Once again, we should look at what our baseline statistics are. We are a vulnerable population. That 2019 community assessment showed that the prevalence of depression in our county is unfortunately quite high at 26.8% relative to the state of California, where it's already at a very high level of 19.2%. And even more sad is a heartbreaking number here. The number of completed suicides, the mortality of suicides per year, that year was 20.22 per 100,000 people. That's double that of the state of California, which was 10.78 per 100,000. And there's a very low availability of caregivers to treat this level of depression. We psychiatrists are certainly not the only providers, but their number is just a measurement of how poorly provided for we are. We have 9.13 psychiatrists per 100,000 in contrast to the rest of California at 13.42. And interestingly, a survey was taken in that same community needs assessment. People were asked, out of 10 possible healthcare services, what do you think the ranking is of these 10 services? And access, excuse me, access to mental, behavioral, and substance abuse services was ranked as the #1 need of all the healthcare needs. So that's where we were in 2019. Statistics would indicate our mental health status is even worse since the pandemic. That is, anxiety and depression in Nevada County is even worse since 2019. We are a vulnerable community. And to that, we are bringing in, or we are being asked to bring in an industrial project that has no indication of bettering the mental health status for the vast majority of people in our county. As a matter of fact, could we have the next slide? I would venture to propose that the potential psychosocial risks include increased anxiety over property values, increased anxiety over dewatering of wells, increased frustration and depression over noise, increased frustration and depression over worsening of the respiratory status of oneself and loved ones, decreased pride and cohesiveness in our community, and frustration that little to no economic return will come to our community. In conclusion, I would like to say that the population of Western Nevada County at risk for one or more negative health effects of the reopening of the mine could be in the tens of thousands. That stands in contrast to the 312 people who are expected to reap the benefit of gaining a job at the mine. And half of that number might even have to come from outside of the county because of the level of specialty that is required of the job. Considering all that I've discussed tonight, I think that the benefit to risk ratio is not close to being justified. The final slide I want to show you is from the California Health and Safety Code. Can we have that last slide? It states plainly what is already law. Oh, I'm sorry, it's the last of my slides. Do we have one more? There we go, that's it. Section 41-700 of the California Health and Safety Code states that a person must not discharge from any source whatsoever quantities of air contaminants or other material that cause injury, detriment, nuisance, or annoyance to any considerable number of persons or to the public, or that endanger the comfort, repose, health, or safety of any of those persons or the public, or that cause or have a natural tendency to cause injury or damage to business or property. Section 41-700 also applies to sources of objectionable odors. The reopening of the Idaho-Maryland Mine risks defying this health code on multiple levels and should be resisted by all concerned citizens of Nevada County. Well, thanks for your time, and let's go on then.
Thank you very much, Christine. It was a really good presentation. And we have a few questions that have been put in. Some of them have been answered by our volunteers. I think some of the questions that came up were really good and weren't specifically related to Christine's presentation, and we might want to kind of revisit some of those again when we get to the second part of our Q&A. But I want to address the ones, a couple that were specific to Christine's presentation. And Christine, if you might be able to field some of these. In the first slide that you showed, the 2019 Community Health Needs Assessment, A person asks, are the numbers, like for example, the 69 out of 100,000, are these normalized for age distribution in Nevada County? Do you know?
Um, that was taking on all age groups.
Mhm.
So if they had been looked at per decade, you definitely would have seen a lower number in lower decades of age, higher in higher. I'm not sure if that is what the person is asking.
Mhm.
But nevertheless, it indicates that the same thing would hold true in any other part of the state of California.
Okay. And there's another question related to Nevada County's unique air impacts. And the question is whether they are unique in terms of different from the Central Valley, and whether other foothill counties up and down the Central Valley are similarly affected by pollution that's being blown in from lower elevations. Uh, Specifically, where is Nevada County on the air pollution spectrum when considering all the counties to the east of the Central Valley? Do you know anything about that?
Um, I am not the authority to ask.
Mhm.
I cannot give you an accurate answer on that. I can tell you that I was observing on a daily basis the air contamination with ozone, nitrous oxide, and particulate matter during our wildfire season, as probably many of you were doing. And for, I'd say, much of the northeast part of the state. And Placer and Nevada County were some of the worst polluted, other than the counties like Plumas that were actually having the wildfire itself. But I sure cannot tell you over a non-wildfire period of time what the answer to that is.
Okay, thank you. Yeah, I have also read some things that while all the Sierra foothills are impacted by the pollution coming out of the Central Valley, it is a common problem to all foothill communities, that the actual physical geography of areas also determines how much air gets trapped, and that Grass Valley in our area is actually kind of unique, or it has particular issues related. And I've seen similar statistics that Nevada County and Placer County are actually have worse air quality standards than Sacramento County. If anybody would like to ask other questions of Dr. Newsom, please put them into the question and answer. And I have a couple of questions that I'd like to ask, if that's okay, Christine. You've talked about how Nevada County has above average health risks indices compared to other areas around the state. So Mike, I'm just wondering, it's like, yes, we do have this. So why are communities with health disparities like ours, such as ours, more impacted by projects or like this proposed gold mine?
The simple answer is that risk factors for most illnesses or conditions of the human body are additive. So for example, if anybody here has ever had a discussion with his or her doctor in regard to heart, let's say heart disease, I'll bet your doctor has talked about the additive effects of a high cholesterol and elevated blood pressure and smoking. And if you have, and there's, a couple other additional risk factors. And if you have just one of those risk factors, it's not quite as important. If you have two, it's more of concern. Three, it's of great concern, etc. And there's the majority of maladies of the human body are affected in the same way. And so I think your question, relay, if I understood it correctly, was why, if we're already suffering from a given disorder, is it worse for us if something like the mine comes in? It's because we're already vulnerable. It's more likely to tip us over. If we have the healthiest of lungs, then all that particulate matter may not make that much difference. If we don't, it could be the metaphoric straw that breaks the camel's back. Additive risk factors.
Mhm.